Hello, everybody. My name is Dr. Aamir Abbas, and once again, I'm here in front of you people for the next session on 10 minutes live stream. As a reminder, these are the sessions which are meant to communicate one concept per session, and each session are 10 minutes or less than 10 minutes long. I will request you people, for those of you who have not subscribed to my channel right now, to subscribe to my channel so that you get notified whenever I schedule a session or whenever I upload a video. Without any further delay, I'm going to go into today's topic, which is depth model. Uh, this is more relevant for the clinical research, and whenever you are doing a clinical research, you need to understand what is a depth model. Depth is an acronym which stands for D, E, P, and TH. And as I said, that applies to the clinical research, which means that whenever you're doing a clinical research, uh, that either you are doing a diagnostic research or etiological research or prognostic research or therapeutic research. And for all the medical professionals, whether they're doctors, they're medical students, they're health professional, nursing professional, psychologist, or any type of health professionals, these terms are self-explanatory, so I do not need to define what is diagnosis, what is etiology, what is prognosis, what is therapy. What is important to note over here is that you need to classify your research work into one of these four types of research when we're doing clinical research. And I will go into a bit of details of that, and I will continue with some more detail in tomorrow's session. So diagnostic research. Um, these are the questions which are commonly asked from the clinicians when they see patients. For example, in the context of diagnosis, when a patient comes to you, they have sign symptoms and they ask the doctor, what do I have, right? So diagnosis is the process of establishing a particular disease on the basis of sign and symptoms and test. And diagnostic research helps us formulate decision rules to come up with an accurate diagnosis. In the same way, etiological research, uh, in the context of etiology, whenever a patient comes, then patient will ask the question from the clinician that why I have the disease, and etiological research establishes the cause of the disease. Once we are sure about what causes the disease, we can prevent the disease, and it also can be used to develop intervention. Similarly, for prognosis, uh, clinicians are asked the question by the patients that what will happen to them when they come up with a particular diagnosis, whether their disease will be cured, or whether it will deteriorate. So prognosis and prognostic research establishes the course of the disease and what is prognosis with and without the treatment, which means that if the patient is given the treatment or with the patient does not get the treatment, what is the difference between the two situations. In the same way, once we have all this information, we want to give the treatment to the patient. So again, the patient will ask the clinician the question that what is the treatment of this particular condition, and there are always a therapy that is needed to improve the patient's condition. And whenever we are talking about therapeutic research, we want to weigh whether the benefits are better than the side effects. Uh, which means that if we give the treatment, um, obviously some of the medicines or pharmaceutical products have some side effects, and we want to make sure through these therapeutic researches that the benefits are more than the side effects are incurred. So all of these things, they may sound very simple. Again, many of the things which I'm talking about, these things are extremely simple, but all of them contribute to something in the area of clinical research, which we call as the depth model. And you need to be sure when you're formulating your research question that where in the depth model your research question lies, because you need to choose a study design on the basis of the research question, and study design option will much depend on where your research question lies in the depth model, which means that whether your research is a diagnostic research, your research is an etiological research, your research is a prognostic research or therapeutic research. Further, there are two terms which I'm introducing right now, but I will be explaining them tomorrow. and I think explaining them after I've talked about the depth model is a good time. One is association and second is causation. So there are situations when you are looking for associated factors, and there are situations when you are looking for causal factors. And once you're clear that what classification of the depth model does your research question belong, then you will be able to identify whether you're looking for associated factors or the causal factors. So this is all for the time being for this short presentation, and I will just remind you once again that these sessions are held on a daily basis at at the same time, and these sessions will be less than 10 minutes with each concept per session, each concept is covered per session. And I will request you people, if you haven't subscribed to my YouTube channel, please subscribe to my YouTube channel to get notification whenever I schedule a video or I upload a video. Please share this content with others, with your students or medical professionals, so that we can enhance this network. And please provide me with your feedback in the comments, because I need a lot of feedback to improve the content, and I am working on making this content, and your feedback is going to be substantially useful in this context. Take care for the time being. See you tomorrow at the same time. Bye.